time I found out I was pregnant, I was a wild child. I was cruising and drinking all the time. The pregnancy was unplanned, and a lot of that I think comes from the irresponsibility of being 18 years old and drinking and partying. You just don't think.
FASD stands for Fetal Alcohol Spectrum Disorders, and it describes a full range of disorders caused by a woman's drinking during pregnancy. Some of the things that you'll notice from somebody who has the full-blown fetal alcohol syndrome is the part on the upper lip is flat. They have like a little button nose, a pointy chin, and they tend to have a smaller head, and the eyes are set differently. On the other end of the spectrum, the symptoms vary anywhere from the ADHD type of symptoms where, they may be restless, they may have some behavior problems. It may look like they're deliberately, forgetting things, but they may have some pretty considerable retardation, even though they don't have the classic face.
When I found out all these things could happen to my baby, I was embarrassed, I was ashamed. I was confused. I wasn't sure what was even wrong with my baby. I didn't want to hear there was anything wrong with my baby. I wanted to stay in denial, and I refused to believe that this could happen to me.
Being pregnant and the risk of alcohol, I didn't know anything about it. I knew that my mom drank when she was pregnant with me. I had been around other women who drank and smoked cigarettes during their pregnancy.
We are recommending absolutely no alcohol intake during pregnancy or during the period of time with breastfeeding. For some women, very small amounts of alcohol can cause problems with the fetus.
Well, when I was little, I kind of felt different, because I had to be held back in second grade. And it's like I kind of had, like other kids, it's like their work seemed to be so easy for them. For me, it seemed hard, and it's like I just didn't think like normal kids.
I get frustrated because I know what I'm supposed to do, but I do it. I do the wrong thing anyway, so it's very frustrating knowing that this is not just a one-day thing, that you're going to have to deal with this for the rest of your life.
As these kids get older, they still are dealing with the brain damage that they've been dealt. People may have higher expectations of them than they're able to deliver. They may be expected to, someday be independent and have a great job and so on. Most likely they'll be in special ed at the very least, and they'll be lucky to graduate from high school.
They don't understand cause and effect. They don't understand that some of their behaviors lead to very dire consequences. 40% of individuals with FASD are incarcerated. This is very important. There's no other developmental disorder that has this high of a rate of incarceration. So these kids, because of their behavioral and emotional problems, are at very high risk to run into problems in our society.
If you're pregnant and you're drinking, you need to stop now. There's no safe time to drink because the brain develops throughout the pregnancy for this fetus. And so the brain damage can happen at any point along the way. The sooner you can stop, the better chances this child has to not have as much damage and retardation.
I don't think that there's anything wrong with my daughter, but she's 3, she's not in school. She's up to par on everything so far. Sometimes it doesn't show up right away. It won't show up in your features. Maybe it won't show up, in their early age, but maybe she, it'll affect her later. Something will trigger her. Something won't grow, after a certain amount of time, and I won't know. I don't know, not now.
Are these children going to be with me every day for the rest of my life? If they're ever going to be able to function normally in society, go to school, get married, have their own children, or if they're going to be in and out of the juvenile justice system or the criminal adult justice system. If life gets too overwhelming for them, are they going to be able to cope, or are they going to take their own lives?
Since I grew up this way, I'm used to the frustrations, but I still am not used to having to deal with my future, what future is going to be like for me. I'm hoping I will be able to deal with my frustration in a way where it doesn't hurt anybody else, or I don't hurt myself.
It's not, fair that children should be. It's just not fair to them that they should have to deal with these disabilities when they don't have to. I don't want to have it, but it's like I just have to, accept my fate. Although it's like I really don't want to, but there's no way I can change it. It's like I just have to accept it, and I just have to say, I'm stuck with this for life. I just have to do the best I can to just live a full life.
FASD does cause permanent brain damage. There is no reversing these effects. You can do early intervention and give them all these services, but the brain damage is not going to magically go away.
I would like to have not drank. I think it would have made my children's life a lot easier. Today, I think the biggest regret I could have was to not have the information and the knowledge that I have about FAS and FASD now. It helps alleviate some of the guilt that we go through, because I can help my children and not feel sorry for myself.
If she's got FASD, I'll be there for her. I give her the emotional support, and we'll seek the help. If in case she's affected by any of this, then it'll affect me too, and we'll do it together.